Thank you.
Let's get our food.
Another night of delivery for Nicole Ryakovich's family of 4. Over the last month, COVID hit them one by one, forcing the Toronto family to stay home for days at a time from work and school.
It's terrifying as a parent.
Ryakovich is now testing negative. Her son was the first one sick back in March. He only had one vaccine dose, and one night the 5-year-old began struggling to breathe. Ryakovich cared for him at home, but says it was a tough decision.
Do I bring my child in who's had a fever for 3 days, or do I stay home because it could be a 9-hour wait?
Healthcare workers in several provinces told CBC News children's hospitals are among those struggling with staff shortages and high patient volumes from COVID and other illnesses.
Their health workers would be similarly affected by disease spread within their communities.
There's just a huge number of increased number of kids coming in with upper respiratory illness and related complications. Many of them, as you would suspect, have COVID.
Ça, c'est la reason for the visit.
In Ottawa, the Children's Hospital of Eastern Ontario is now seeing up to double the typical number of patients in its emergency department and has cancelled some of its surgeries.
The double whammy for us is that we also have many staff, medical staff and volunteers that are off as well because of COVID symptoms.
It's a similar situation at the Hospital for Sick Children in Toronto, where emergency visits are back to pre-pandemic levels, while roughly 1 in 10 staff are off sick.
We're seeing a lot of kids age 0 to 5 who are not immunized. And so we're particularly conservative in ensuring that no one's coming to work sick.
Although hospitals are under pressure, pediatricians say parents should seek medical advice if their child's COVID symptoms start to worsen, including a high fever or trouble breathing. Lauren Pelly, CBC News, Toronto.